Today we will learn about comfort devices in detail. So please watch this whole video. If you like my video, please do like and share. And also don't forget to subscribe my channel and hit the bell icon for my upcoming videos. Now we will learn about introduction of comfort, that is why comfort is needed. So the comfort is mainly associated with rest, exercise, with relation of one part of body to the another, with the bed and with the whole environment. As a comfort is an important phase of every procedure as it is an aspect of total care of the client. Now how we can define comfort? So firstly, comfort is called a state of free from pain, discomfort, tension and anxiety. Another it is absence of irritating stimuli that will distract individuals' attention, that will refrain from completing the task that the individual is able to complete. Now what is discomfort? So discomfort is defined as a want of comfort or ease due to patient is suffering from any pain and irritation. Now, what are the causes of discomfort? When the patient is feeling discomfort, there are many causes which will be discussed one by one. Pain. Due to any disease condition, patient is suffering from pain leads to discomfort. Due to any lack of exercise, due to any restrictions of movements due to weakness, wrinkle, soil and wet sheets, temperature extremes, that is changes in body temperature, to bright lights and glares. This will cause irritation to the patient and ultimately causes discomfort. Feeling of insecurity due to lack of sleep, that is insomnia. Due to any uncomfortable position is given to the patient. Due to indigestion, that is irritable bowel movements. Due to fear and anxiety related to illness and also due to admission in hospitalization. These are the various causes that can lead to discomfort to the patient. Now we will discuss about the comfort devices. Why the comfort devices are important. Introduction. So the comfort devices are invented articles which would aid to the comfort of the client when used in appropriate manner. So basically, comfort devices are mainly used to provide comfort to the clients. Comfort devices relieve the discomfort of the patient and help in maintenance of correct posture. Next, what are the comfort devices? So, comfort devices are called the articles which will help to provide comfort to the patient by relieving the discomfort and maintenance of correct posture. Second is comfort devices are the mechanical devices which are helped to provide optimal comfort, that is greatest comfort to an individual. Now what are the purposes of comfort devices? In which way comfort devices are useful? So it will useful in relieving of discomfort to the patient and provide maximum comfort. To immobilize body part. For example, in a fracture patient, doctor assisted to immobilize the given fracture part. So comfort devices can be useful to immobilize that body part. To promote maximum comfort, that is to provide great comfort. To relieve pressure on the body parts. To maintain correct posture. To prevent falls and accidents. There are some comfort devices which will help in preventing of falling and accidents. and to conserve maximum energy by preventing maximum strain, that is, by preventing maximum force. Now we will learn about various comfort devices. First, list out of various comfort devices: pillow, air cushion, backrest, side rails, wedge or abductor pillow, bed cradle, trapeze bar, knee rest, sandbags, hand rolls, foot rest or footboards, bed blocks, air and water mattress, cotton rings, cardiac table, and Trochanter Rolls. We will learn about these various comfort devices in detail one by one. Pillows. This is the picture of pillow. So the pillows are used to give comfortable position to the patient. Mainly pillows are used as well as in the home as well as in the hospital side for providing comfort. Pillows are mostly used for supporting various body parts. Now purpose is why pillows are used: for maintenance of proper body alignment, for supporting of body part in a good alignment. Pillows will help to reduce body pressure. Pillows can be used by folding it, by rolling and tucking against the body for maintenance of position. And it is also used for supporting of head, neck, arms, legs and part of the back, adds to the physical comfort. So the pillows are mainly used for supporting of head, neck, arms, legs and part of the back for providing physical comfort. Now what are the clinical implications? Means the uses of pillow in a hospital side. So pillows are mainly used to splint and incision area in abdominal and thoracic surgeries to reduce post-operative pain. So pillows are used for splint and incision area for reducing of post-operative pain. Air cushion. So air cushions are made up of rubber material and are round in shape. Air cushions can be used by inflating air inside it, and one principle is to be remembered while applying air cushions is that it should not be directly in contact with the skin. The air cushion should be covered because it is rubber material. If it is not covered, then it can cause irritation to the patient and there can be the chances of pressure source to the patient. Purpose is how air cushion is useful: for relieving of pressure on certain parts of the bodies like elbows and heels, and to provide comfort to the client. Backrest. This is the picture of backrest. It is mainly used for providing support and for the rest of the back of the patient while the patient is in sitting position. It can be adjusted at desired angle. If in case extra pillows are also needed. By using backrest, the arms of patient are well supported. Purpose is: backrest is mainly used for elevating the back and for supporting back and head of the patient. It is used to relieve dyspnea, means breathing in difficulty, in asthmatic patient by providing Fowler's position. Fowler's position is a type of sitting position. To promote drainage from abdominal cavity in case of any abdomen surgery. given especially for heart and asthmatic patients and also for post-operative period. Side rails. Side rails are the bars positioned along the side of the length of the bed. It is seen in picture that side rails are along the side of the length of the bed. Now purposes of side rails. So side rails are useful for maintenance of patient safety, and with the side rails the patient can easily move in the bed. The chances of falling is decreased, and patient can roll from side to side, and also in sitting position patient can sit freely. Wedge or abductor pillows. This is the diagram of wedge or abductor pillows. Abductor or wedge pillows are triangular shaped pillow made up of heavy foam. Now what are its purposes? So it is used for maintenance of legs in abducted position, that is away from midline of body in case of after the total hip replacement surgery. In hip replacement surgery, the legs are being abducted. So it is used for abducting of legs in total hip replacement surgery. Bed cradle. This is the picture of bed cradle. It is made up of wooden, metal or electronic material. It supports and takes off the weight of the bedding. They are semicircular in shape and made up of wood or metal. Purposes of bed cradle. Mainly used in case of burns patient, as it will help to prevent the top cloth coming in contact with the patient. Important advantage of bed cradle is it will help to allow air to limbs surrounding the bed, and it will help in apply heat in case of dyeing plaster cast. Electronic bed cradles are used to supply the desired warmth in case of shock. Next comfort device is Trapeze bar. This is the picture of Trapeze bar. It is a type of triangular device which is attached to over bed frame as seen in picture. Now what are its purposes? Enable the patient to raise the trunk of the bed. So it will help to raise the trunk of the patient of the bed. Help the patient in performing exercise for strengthening of arms. It will help the patient to surface or move up in bed to wheelchair. Now, what are the clinical implications of trapeze bar? So it is ideally important for patient with traction, and in case of plaster cast for assisting with changing position in bed and carry out any nursing procedure. Another important comfort device is knee rest. This is the picture of knee rest. Knee rest is a device which is placed under knees to provide comfort. Purpose is how knee rest is useful. Knee rest is useful in giving relaxation and relieving of pain on tendons which are present beneath the knees. Another is sandbags. This is the picture of sandbags. Sandbags are canvas, heavy, cylindrical or rectangular bags filled with sand inside it. Sandbags are made with cloth, rubber or plastic bags filled with sand. They are 1, 5 and 10 pound in weight. Now what are its purposes? So sandbags are used for supporting and immobilizing a limb, for application of pressure in case of any bleeding occurrence, used for supporting as in fracture bones. What are the clinical implications of sandbags? So it will help it to prevent foot drop and external rotation of thighs. Another comfort device is hand rolls. Picture of hand roll. Hand rolls can be made by folding a washcloth in a half, rolling it in lengthwise and securing the roll with a tape. How the roll is handled. So roll is placed against palmar surface of the hand as seen in picture. Now what are the purposes behind hand rolls? So hand rolls are used for keeping the fingers from being held in a tight fist, leading to flexion contracture. Flexion contracture is defined as a chronic loss of joint movement in the patient who are unable to move hands due to any paralysis, injury or any disease condition. So hand rolls can be used for providing movement in case of paralysis, injury or disease, and for maintenance of fingers in a slightly flexed position. Clinical implication of hand rolls. The roll is placed against palmar surface of hand as we have already seen in picture, thumb and fingers in a functional position. Next is foot rest. Another name is foot boards. This is a picture of foot board. The foot rests are the mechanical devices which are used to give rest to the feet. And the footboards or foot rests are usually made up of wood, plastic or heavy canvas. Now purposes of footboard. Helps to maintain the normal position of the feet. It prevents foot drop and also prevents patient from sliding down. Important comfort device which is mainly used in hospital is bed blocks. This is the picture of bed blocks. So bed blocks are the block made up of wood or metal and its size may be vary from high to low. Bed blocks are placed under the foot of the bed so the bed can be raised. Now what are the purposes of bed blocks? For prevention of shock, to stop any hemorrhage or bleeding, to retain enema. So what is enema? Enema is the introduction of liquid or gas into the rectum for expulsion of it contains and for any introduction of drug. After any spinal anesthesia, to provide traction. Traction means pulling off something. Another is mattresses. So mattresses are mainly of two types. First is air mattress, second is water mattress. So mattresses are filled with air or water which moves from one part of the mattress. And the principle behind mattress is that when the pressure is exerted by the body, it will distribute it equally in all the directions. While using the mattress should be covered with light clothes. This is a picture for air mattress as well as for water mattress. Now, what are the purposes of mattress? for improvement in circulation, for prevention of pressure sores. So what is pressure sores? So pressure sores are called as ulcer formation due to ischemic necrosis of tissue leading to ulcer formation. Used in very thin or very obese patient and used in chronic bedridden patient, long-term bedridden patient. Caution, that is, while using mattress, the care should be taken for avoidance of any punctures in the mattress with needles, pins or other sharp objects. Another important comfort device is cardiac table. This is the picture of cardiac table. So the cardiac table is a device as an overbed table and is placed in front of the patient while they are in the Fowler's position or in sitting position. Now what are its purposes? So cardiac table is used by the cardiac patient who can lean forward with a pillow, can be used for writing purpose, for serving food and other self-care activities like reading newspaper, reading books. Clinical implication for cardiac table, that is, not to raise food in case of increased intracranial pressure. Next is Trochanter Rolls. This is the picture of Trochanter Rolls. The Trochanter Rolls can be made from thick cotton sheet and it is folded lengthwise extending from greater trochanter of femur as seen in picture up till popliteal space. So popliteal space is called as a back portion of the knee joint. So trochanter rolls can be made with thick cotton sheet and extending from greater trochanter of femur to the lower border of popliteal space. Now purposes of trochanter rolls. It will help in prevention of external rotation of legs when the patient is in supine position. When the patient is sleeping, it will help in prevention of external rotation of legs. Next is hot water bag. This is a picture of hot water bag. So hot water bag, it is a bag made up of leather, canvas or any other material in which hot water is filled and mainly used for giving hot application. One important care is to be taken while applying of hot water bag is, first we have to cover the hot water bag with a cloth before giving any application on the body part to prevent the friction and irritation from rubber material. In which way hot water bag is useful? For relieving from pain, for promotion of healing, to provide warmth to the body, for reducing of inflammation, for relieving of muscle spasm. Muscle spasm is voluntary contraction of muscle and it is unable to relax. Another important comfort device is ice bag. This is the picture of ice bag. So ice bag is a small rubber bag filled with small pieces of ice along with salt and is mainly used for giving cold application. One important is to be remembered while using ice bag is salt is added in ice bag for preventing the ice from melting. Purposes of ice bag. for reducing of temperature in case of pyrexia or fever, for prevention of bleeding or hemorrhage, for relieving urinary retention. Urinary retention is an inability to control or bladder empty. To relieve inflammation, to decrease metabolic rate of the body. Next is air rings. This is the picture of air rings. This is look as similar to air cushion. Air rings are made up of rubber and it can be used about inflating half full of air in it. Before inflating air in it, it should be tested for any leakage, and after filling of air, it is placed under the patient's hip in such a way it is not in direct contact with the body. Next is cotton rings. This is the picture of cotton rings. Cotton rings are wrapped with bandages with outside area and are placed under the bony prominences such as heels. Purposes of both of air and cotton rings are used to lift a hip from bed for prevention of bed sores. It helps to prevent direct pressure on bony prominences like as heels, and it helps in improvement in circulation. If you like my video, please do like and share with your friends, and also don't forget to subscribe my channel and hit the bell icon for my upcoming videos. Thank you.